Thank you, everyone, and you're very welcome to this meeting of the Evolution and Psychiatry Special Interest Group of the College of Psychiatrists of Ireland. I'm Henry O'Connell, founding chair, and I'll be handing over to my colleague, Dr. Gurjat Brar, as the new chair from today, and Dr. Kevin Lally is vice chair. And we have 11 previous talks on the playlist, the Evolution and Psychiatry playlist of the College of Psychiatrists YouTube channel, and they are well worth going back over. We have a lot of excellent speakers covering big topics in the area of psychiatry with an evolutionary perspective. But today I'm very happy to be able to welcome Dr. Riya Gosrani, who is going to talk to us about mental health and the environment from an evolutionary perspective. Riya is a resident doctor in her F2 year at UCL, University College London Hospital. She graduated from UCL in 2024, having intercalated in global health during her third year. Between her fifth and final years of med school, she interrupted her studies to complete a master's in medical anthropology at the University of Oxford, where she developed a keen interest in evolutionary medicine. Her dissertation examined the persistent use of race as a proxy for biological difference in clinical practice, applying evolutionary principles to challenge algorithmic bias and racialized diagnostic tools. Riya presented this work at international conferences, including the 2024 European Human Behavior and Evolution Association Conference in France, and the International Society for Evolution, Medicine and Public Health, that's ISEMF, conference in Durham. In 2024, Riya became the youngest doctor globally to serve on the ISEMF program committee, where she was introduced to evolutionary psychiatry. This inspired her to write an article that reframed understanding of alcohol use disorders through an evolutionary lens, earning her the Charles Darwin Evolutionary Psychiatry Special Interest Group Prize in the Foundation Doctor category. Riya then co-organised a national training event that took place earlier this year, which introduced psychiatric trainees to evolutionary perspectives and was awarded the London Foundation Award for Teaching Excellence. Riya aspires to pursue a career integrating academia, public health, and clinical practice, with a particular focus on applying evolutionary principles to improve patient care and address health inequalities. So again, Riya, you're very welcome, and you have the floor.
Okay, great. Thank you so much, Henry, and thanks everyone for having me here. So as Henry mentioned, my background is a bit of a mixture of things, so medicine, anthropology, and I've always been very interested in public health. But I only really started to sort of look at it within the context of psychiatry during my master's. And after meeting Henry and Paul and a couple of others at the conference in ISEMF, that's when I started thinking about how turning this into sort of a more academic project, so writing papers and so on. So in this paper, I'm going to be talking about a paper that we've written, and it's titled Mental Health and the Environment, Evolutionary Perspectives. We basically argue that evolutionary perspectives have a lot to offer psychiatry, both in how we understand mental illness, but also how we treat illness. How we approach the treatment to mental illnesses. And it provides a much deeper and broadens our understandings. And it's a much more integrated framework than many of our current models. So in today's talk, I'm going to follow quite a similar structure to the paper. So I'll just start by giving a brief overview of evolutionary perspectives, and then we'll explore what these perspectives can tell us about why we become unwell. And then I'm going to hone in quite a lot on mismatch theory, explaining why the modern day environment plays such a crucial role in shaping and contextualizing psychiatric disorders today, and also just thinking a little bit about what environment means, because often it's framed in quite a narrow way, which we've tried to avoid. And then finally, I'll move on to discuss the clinical implications for psychiatry and beyond. with the aim of improving health outcomes at both the individual and population level. And just a couple of key terms that we're going to be using is biophilia, which is the idea that humans have a tendency, an innate tendency to seek connection with nature, and also the emerging concept of green care, which basically is a way of trying to incorporate biophilic principles into psychiatric practices themselves. So this quote, nothing in biology makes sense except in the light of evolution, really encapsulates the essence of our paper and the whole sort of SIG community. And although we teach doctors sort of the molecular and foundational foundations of disease, we rarely teach them the evolutionary ones, even though they often offer a framework which basically helps us understand why people get sick in the first place. And I think when I first sort of started hearing about this approach, um, I was just shocked because it made me realize that so many of the, especially in psychiatry, where when I was a medical student, it seemed to be quite a top-down approach where we would cluster people into symptoms and categories based on um, arbitrary measures and then place a diagnosis on them and then they would receive treatment for it. But I think with the evolutionary medicine approach, you're not necessarily assuming what they have, you're just recognizing patterns and then trying to understand where your patient's coming from and trying to understand these whether the underlying rules that govern patterns in nature are helpful or unhelpful, as we'll later see in this talk. But it's just a nice way of not having such a top-down approach with things like diagnostic criterias. And it's a really useful and powerful way to have a different way in with each and every different patient in every case. So this is just to depict, I mean, psychiatry has definitely developed a lot over the years, and I don't want to minimize it to such a reductionist model as is what's seen on the screen. But stereotypically, psychiatrists often focus on what's wrong, which are kind of known as proximate causes of illness. So, for example, in a condition like depression, they might frame it to a patient as a chemical imbalance and give a SSRI. What an evolutionary perspective offers is something a bit deeper than that. So it starts to question, why are we feeling sad in the first place? Or why our affective and motivational systems have evolved in the first place? So what function might they have served? And how do they exist? And why do they go wrong in certain conditions? Um, and once you start sort of shifting the questions, a lot can be gained from it, not only in your own understanding of an illness, but also through psychoeducation and also even in sort of treating patients, you might think about that in a different way. These are just a couple of the other questions that an evolutionary psychiatrist might try and ask when thinking about a specific behavior or trait. And it's further highlighted here, which is a really common table that is shown. I'll just whiz through it for the sake of time, but essentially, these are the four questions which are posed by Tinbergen for understanding behavior and biological traits. So if we think about the current approach in psychiatry as being the top row, so proximate causes, this sort of only focuses at quite a superficial level, trying to think what's gone wrong. So as I mentioned, neurochemicals or neurotransmitter imbalances or genetic vulnerabilities. But if we look at the second row, which represents the evolutionary or ultimate perspective, we're asking why our affective and motivational systems evolved. So, did they serve a function? Do they still serve a function now? And it also asks us more questions in modern day times. Why do they exist in the forms that we see them in? And why might they go awry under certain conditions? So this broader view encourages us not only to think about how traits develop within the lifetime of an individual, but also how they've evolved across ancestral species, which is known as phylogeny, as opposed to ontogeny, which is within the lifetime. Um, and just another point, a point of departure, which is quite important to mention at the start, is Engel's biopsychosocial model, which really picked up over the last few decades. And it definitely pulled clinicians away from the purely reductionist model where it was where they were purely relying on a biological cause of illness. So this model takes into consideration that there are other factors, not only biological but also psychological and social, that affect someone's health. So, for example, if we use this approach, we could then combine medication with psychotherapy and social support. Um, but what quite a few evolutionary psychiatrists or researchers have found is that we can extend this model by adding an evolutionary lens to Engel's original biopsychosocial model. Um, and then if we do this, it basically is a really nice way to unify how the biological, psychological, and social explanations come together because they are deeply interconnected. They're not just sort of three separate boxes which have a bit of overlap. Um, and it's also really good for broadening our understanding of the environmental influences on mental health. So extending beyond the natural world to include the complex dimensions of the social and ecological conditions in which we live. And the evo and social aspect of this model reminds us that mental illness emerged from an intricate web of evolutionary, environmental, and societal factors. So just to keep that in mind as we go through this presentation, um, so I'll briefly just outline Randolph Nesse asked six main questions within an evolutionary framework for why we become unwell. And it's just a really important grounding for all kinds of medicine, not just psychiatry, if we're trying to think about things through an evolutionary perspective. So I'll just give a few examples. They're not all psychiatry related because we have some more after this. So starting with mismatch, you can see on the top right, I've written the environments of evolutionary adaptiveness, or EAA. EEA, that was meant to read. So essentially, when we're talking about mismatch, it's usually describing how our slowly evolved bodies and minds, which developed over millennia to ancestral environments, are now coming into conflict with the demands of modern life. And these ancestral environments are referred to as the environments of evolutionary adaptedness. So essentially, this is just saying that our brains and bodies evolved for a very, very different world where we were hunter-gatherers, even socially living in smaller groups, constantly moving, facing unpredictability. But now what's happened is that the pace of environmental change has far outstripped the pace of evolutionary change. So what it could be described that we're now maladapted in some ways. And a really common example of this is obesity. So in ancestral environments, you could imagine how it would be beneficial to seek out high calorie foods, so fruits with high sugars or fats, because they were rare, and when they did consume them, they would be really valuable sources of energy. But in today's world, and we describe this as weird society, so Western, educated, industrialized, rich, democratic, these same preferences can work against us. Um, and this idea of mismatch is seen because our primitive cravings haven't caught up with the environmental changes. And so rather than sort of benefiting from it, we're just seeing increased rates of obesity, diabetes, cardiovascular disease, and so on. Um, so yeah, it's also just a reminder that our adaptability as a species also does come with costs and that's especially the case when we live in an environment that has changed as fast as ours has. So the next one is out of six, Nessie's six questions is co-evolution with pathogens. And the COVID pandemic was a really obvious example of this, how there's an ongoing arms race between humans and other organisms. And one of the main reasons why infections persist and they haven't just been wiped out is because pathogens have the ability to evolve a lot faster than their hosts. And in the COVID-19 pandemic, even the rollout of PPEs, masks, vaccinations, it's still we still really struggle to keep up with the virus. Um, okay, so next, this one is about the idea that's called constraints. So this results from the incremental nature of evolution. So what I mean by that is evolution proceeds through small steps rather than large leaps. So it kind of limits what adaptations are possible. I think the other term for this is path dependence. So once an adaptation has moved within a certain direction, natural selection can't just simply reverse it because that would take a lot of time. And so with again changing environments, this often prevents the stable optima from being reached. And a really good example of this is that of the recurrent laryngeal nerve. So there's a picture here of a child and in a giraffe, and essentially this nerve innervates our larynx. But we can see that it takes a detour down the neck and then back up again. And we can already see this in humans, but in giraffes, because of the length of their neck, you can really see the extent to which this is a detour. And this is probably unnecessary and also almost certainly imposes a cost on the giraffe because it has to grow more nerve than necessary, and the signals will also take more time. Um, but ancestrally, if we think about constraints, the direct route for the nerve was to pass through the posterior towards the aorta, but as the neck lengthened in the giraffe's evolutionary lineage, the nerve was just led on this detour, which we now visualize. And just another point to make about this is that this it's important to remember that natural selection operates in the short term. So every step takes place as a modification of what's already present. They can't, and so it can be led to imperfections due to historical constraints. Next, we have trade-offs, and I think a classic example of this is that of sickle cell disease. Essentially, if you carry two of the same alleles, that would likely lead to serious illness. But if you're heterozygous, um, meaning you only carry one copy of the mutation, then that actually is shown to increase survival rates in people living where malaria is endemic. So that's just one example. And then this is reproduction at the cost of health. So this idea comes from the fact that natural selection prioritizes passing on genes over individual well-being. Um, so if you look at the table on the right, it's quite small, but essentially it's a study that showed teenage mothers tended to have shorter life expectancies. And similarly, other studies have shown that people in socioeconomically disadvantaged groups are more likely to smoke, drink, exercise less, and ignore health advice. And evolutionary theory offers quite a nice explanation for these patterns. I think it's quite destigmatizing because um, it ties quite nicely with social determinants of health. So if someone grows up in an environment that is unpredictable or harsh, even before birth, so whilst in the womb, there might be an almost described as an evolutionary hardwiring. So they might not necessarily consciously, but subconsciously expect a shorter life. And in those contexts, it can then make sense from a gene propagation point of view to take more risks and to reproduce earlier rather than invest in long-term health, um, which is sometimes described as sort of live fast, die young, and pass on your genes principle. Um, so in other words, whilst this might seem like a maladaptive behavior, it might actually reflect deep evolutionary trade-offs shaped by ancestral and environmental pressures. And I think that when I saw this, it also made me think of something that I learnt in public health, which is that often when we provide health information or voluntary screening services, social inequalities actually increase in health because those interventions are often disproportionately taken up by people in higher socioeconomic positions. Um, so we need to think really carefully taking this into account, how we're going to make public health interventions which will really increase equity and not do the opposite of what we're trying to do. Okay, so next and the final question that Nessie asks is about costly defenses. So some responses that we often label as pathological, like having a fever, you often give someone paracetamol, or low mood or anxiety, or even diarrhea if you have a bug that you're trying to expel. They might actually be adaptive reactions to real or perceived threats. Um, and these responses can be costly, of course, in terms of energy or well-being, but they don't exist for no reason, and their purpose is often to signal danger, to mobilize the body's immunological defenses, or encourage behaviors that ultimately have helped us to survive. The problem is that in modern medicine, these signals are sometimes misunderstood and overtreated, which can actually obscure their evolutionary purpose. So, for example, anxiety might feel burdensome, but it can also heighten vigilance in risky situations. And again, fever might feel uncomfortable, but by raising the temperature, it's helping the body to fight infection. Um, and so understanding these responses through an evolutionary lens or as evolutionary defenses, it really helps us to understand why they exist and sometimes why they seem excessive, but also most importantly, why a fits all doesn't really work in medicine because you have to take this case by case and make a clinical judgment based on that. Okay, so now that we've just done a whistle-stop tour of the main evolutionary theories for why we become unwell, um, we can start thinking about how an evolutionary perspective can help us in psychiatric practices. And understanding these principles isn't just academic, it can help guide how we interpret symptoms, design interventions, and also make sense of health patterns in different populations. Um, so the first way we can do this is through psychoeducation. And a lot of people might already be doing this without realizing or immediately remembering that this is just from evolutionary theory. But I think it's quite often for patients with anxiety to be told that this might have served a purpose years ago when you needed to run away from a predator or so on. Um, but this table is a quite nice way of depicting anxiety and also our body's protective mechanisms. So the idea that sometimes we can give false alarms, or it might even seem excessive. But if you think of a smoke detector, it can go off over something minor like burnt toast, and it's annoying to have to switch it off, but it's harmless. And that's similar to our bodies producing a false alarm. So that could be just used to help someone understand their own experiences of anxiety. But if the detector fails to go off when there's real fire, we can see here that a false miss would lead to a burnt down house. And in real life, using that analogy, it could be describing a real threat, which, if ignored, could be life-threatening. Um, but this table also does illustrate that there is a design trade-off. So evolution probably prioritizes safety over perfection, and so systems are tuned to avoid missing the threats, even if that means sometimes generating false alarms. Um, and whilst explaining this to someone with anxiety might not immediately make their anxiety go away, it still can help patients to understand why their responses, even though they are very distressing in a lot of cases, they actually are protective mechanisms that once might have served a fitness advantage, rather than just being seen as sort of weakness or dysfunction. Um, we also believe that there's a lot of untapped potential in applying evolutionary perspectives to clinical psychiatry. So, just looking over here on the left, that's depicting a patient in a psychiatric ward, and on the right, we can see one of the tick boxes that is often relied on if we look at the DSM or ICD or clinical guidelines. Um, and so, it's this sort of over reliance on verbal narratives and checklists. Um, through which we're arguing that clinicians need to view behavior as evolved communication systems rather than just assess the symptoms to be pathologized. Um, and the other thing to note from here is if we imagine the number of consultations that have taken place in clinics or in psychiatric hospitals, that's very different to someone's day-to-day life, where no doubt they might be struggling as well. But that was a really important point that was raised by both Nessie and Troisi, who came up with a goal system and the social system. So Troisi's goal system essentially offers a practical way to bring evolutionary thinking into clinical psychiatry. And it stands for giving less weight to symptoms, observing actual behaviors, assessing functional capacities, and leaving your office. Um, Now, this idea is quite simple if you think about what it's saying, but really, really powerful. So rather than just relying solely on what patients report in the clinic room, if we can somehow observe or get an account of how they're behaving in real life settings, and this draws quite heavily on ethology, which is the study of animal behavior. So asking what behaviors evolve to do and under what conditions they make sense. And it encourages clinicians to think like evolutionary biologists. And Nessie's system also complements this. So looking at the list of points over there, it just helps us move beyond the simple symptom checklists and better understand someone's behavior in the context of both evolutionary pressures and also everyday environments. So if we are to use evolutionary theories in psychiatry, it's also vital that we start thinking about how to reframe clinical research questions, because right now they're very much focused on proximate questions rather than ultimate ones, because they haven't been guided or led by evolutionary perspectives. Um, and essentially, if we understand the evolutionary history of a particular trait, we can identify which aspects of that trait we are working with and also which ones we are working against. And this would allow us to make much more informed hypotheses about the underlying mechanisms of mental health conditions and also the kinds of interventions that might align with, rather than conflict with evolved human biology. But what's also really important to mention here is the two key conceptual errors in evolutionary thinking. So first of all, viewing symptoms as diseases. So this risks interpreting protective responses like anxiety or low mood as inherently pathological. So for example, a temporary low mood following a stressful event could be adaptive and it could be a signal to slow down and conserve energy, not necessarily a disorder. But then on the flip side, what we don't want to do is to view diseases as adaptations. So that's clearly also harmful in some cases. So, for example, in schizophrenia or in Alzheimer's disease, trying to argue how they are somehow beneficial can be difficult and also harmful as well as a clinician. So, it's sort of a fine balance to be had between the two. But we just need to be really careful not to get muddled between this, because if we misapply evolutionary reasoning in this way, it could then even further distort research questions and our clinical understandings of mental illness. And I just put those pictures of the DSM or ICD there because they serve as the cornerstone of psychiatric diagnoses, or they have for a long time, and that's still how I was taught about mental health when I was at university. Yet we know that it's been really widely criticized for overdiagnosing, over medicalizing normal human suffering, and also being culturally biased. And it also often fails to distinguish between diseases and symptoms. Wakefield suggested global categories of mental illness, and he suggested asking yourself these three questions when thinking about a patient. So first of all, are cognitive or brain mechanisms functioning normally, or are they defective? Number two, did the symptoms arise from novel environmental pressures? And number three, are the symptoms in the interests of the individual, their genes, or neither? And asking those questions can essentially help you to distinguish, is this an adaptive response from genuine pathology or not, and then guide more precise evolutionary informed research. So a final point on applying evolutionary perspectives in psychiatry is illustrated by this bell curve, which shows how a trait is distributed across a population. So while there is variation between individuals, there is also a shared vulnerability. Most of us possess the same or very similar underlying systems, even if only some go on to develop diagnosable disorders. And from an evolutionary perspective, disease can arise because populations are adapting to a complex fitness landscape. And humans are having to face trade-offs, balancing multiple competing design features. So, what benefits one aspect of survival or reproduction might create vulnerabilities in the other. And in our paper, we argue that evolutionary approaches help us to see the universality of human suffering and mental illness. So the vulnerabilities that we observe in mental disorders are often byproducts of systems that evolved to serve vital functions. And these are symptoms that we all carry, regardless of whether we meet the diagnostic criteria. And this perspective can be profoundly destigmatizing because it shows that mental illness is not a failure, but rather a reflection of the inherent complexity of human adaptation and potentially traits that actually allowed us to survive to now. So I mentioned earlier I was going to talk a bit more about what we mean by the environment here in our paper, and also just more broadly thinking about psychiatry, evolutionary medicine, and the environment. So essentially, I touched on the environments of evolutionary adaptiveness, so our ancestral environments, and how those differ from our weird societies. And we also discussed how the biopsychosocial model could be deepened further if we add the Evo bit at the start. What this diagram illustrates is that environment can extend far beyond biology or genetics, or environments as we know it. Michael Marmot was one of the first professors at UCL who I saw talking about social determinants of health, and we wrote about this in our paper, how he described social disadvantage functioning as a kind of pollutant, limiting early cognitive and emotional development, and having the power to shape lifelong mental health outcomes. And these social conditions can affect parenting, accessing to opportunities, and ultimately an individual's ability to flourish. And so thinking environmentally also opens up new research and therapeutic possibilities. For example, the concept of biophilia, which I described earlier as being our innate connection to nature, can inform therapeutic approaches. And incorporating natural and social environments into interventions could also help improve mental health outcomes. And just one point to make is that when we're talking about environments in evolutionary terms, we're usually talking at two levels, so the micro level and the macro level. So the micro is actually quite broad, so it's not just the immediate, it's not just the individual, but it's their social networks like family and school. And then when we talk about macro, we're talking about broader societal and ecological conditions, which I'll go on to explain it towards the end. But we need to combine both micro and macro levels to help us design more comprehensive evolutionary informed strategies for both prevention and care of our patients. So this is a picture of hunter-gatherers, and it's just exemplifying the fact that our current day environments are very mismatched to what they were when we were hunter-gatherers. In these environments of evolutionary adaptedness, people tended to live in small, closely bonded groups of relatives, and life was harsh and dangerous, and contact with strangers was rare. So now in modern day social environments, we often have less contact with family and kin, and homes might be more comfortable, but social isolation is increasingly common. And this mismatch can create new vulnerabilities like loneliness, isolation, and all of these, as we know, are really strongly linked to poor health outcomes, not only in regards to mental and cognitive health, but also physical health. And it's through understanding what these mismatches are that we can start to think about how to tackle mental health challenges today. So, how can we increase opportunities for meaningful social connection? And how can we engage communities more and design environments, both physical and social, which better align with our evolved needs and help reduce these discrepancies? And just a quick touch on substance use and our brain's rewards systems. So the key thing with modern day alcohol use and psychoactive drugs is that they are available in much greater quantities and concentrations than they were historically. And I believe that evolutionary understandings can really help alleviate stigma around these conditions. If we start to understand why certain groups are more susceptible in the first place, which is what this framework explains quite nicely. Essentially, it talks about how modern access to high potency alcohol and synthetic psychoactive drugs um, represent a new challenge because our reward systems are poorly adapted to these. Um, these substances essentially hijack our evolved mechanisms for reward and motivation in ways that weren't possible in ancestral environments just because there wasn't the availability present. And if from an evolutionary lens we start to ask those more ultimate questions again, such as what is the evolutionary significance of emotions? Um, Emotions naturally guide us towards experiences that historically enhance Darwinian fitness. So pleasure signals that certain behaviors were beneficial. But what substances like alcohol and psychoactive drugs do is that it exploits or literally hijacks these systems and it creates a false sense of fitness benefit. For example, alcohol activates the mesolimbic dopaminergic system, which is a neural circuit associated with pleasure. And by stimulating this pathway, alcohol generates those feelings of reward and mimic real fitness advantages, which helps why alcohol-related behaviors might be so reinforcing, in particular for individuals from lower socioeconomic statuses, because they often face structural disadvantages and social stresses. And so alcohol might be able to provide a temporary escape by falsely signaling a fitness benefit when the real rewards are limited. And just the last point on this is from a life history theory perspective, these behaviors might be interpreted as part of a fast life history strategy. So, immediate gratification and risk taking in response to precarious environments. And this would reframe harmful behaviors not merely as dysfunctional, but as adaptive responses to structural challenges rather than just placing the blame on the individual alone. And that's why I think that these perspectives can help shift our understanding and reduce stigma if we frame everything within the underlying biological and social contexts in which these problems develop. Um, and just one last point about this is that it also suggests that in current day psychiatry, a lot of emphasis is on the individual, but I think this is all just going to show that we need to do more about changing the actual environments around people, lifting people out of poverty, lifting people out of the circumstances which might make them more susceptible to drink or use substances in the first place, which might fall outside of the realms of psychiatry as we know it right now or today. Um, so I'll just finish now by going through a few examples of how we can use this perspective to improve health outcomes. So I'm going to start at the micro level, which, as I mentioned in evolutionary terms, is the social environment. Um, so we've seen that many modern day psychiatric issues can be understood as arising from a mismatch between the EEAs and our modern society. As a logical extension to this, many of the measures I've outlined here are ways in which we might reduce this mismatch, which is what we talk about in our paper. And this is known as mismatch reduction therapy. And it's quite an exciting thing to look at because it's not being researched a lot or used a lot in psychiatry. So it's something that hopefully can be picked up in the next few years. So the first thing that we suggested was more thoughtful urban planning. So just increasing access to green spaces and designing houses that encourage communal living can help recreate some of the social and environmental conditions that our brains are adapted for. And it's not just about aesthetics, it's about improving mental well-being, reducing stress, and even sort of encouraging people to spend more time in these outside areas, which would strengthen social cohesion. At secondary levels of care, evolutionary and environmental insights can help design the hospital environments. So by emphasizing biophilic principles like access to greenery, but also things like involving family and care planning where that's appropriate, because that would likely improve health outcomes, and also prioritizing continuity of care. Um, because a lot of studies show that the efficacy of some types of therapy is often not based on the therapy itself, but rather how well the patient gets on with their therapist or how well they get on with their psychiatrist. And I think that can be explained quite well by evolutionary theory, by the fact that we are very social beings and social bonds have clear benefits for mental health. So for patients, it might be useful having regular contact with familiar staff wherever possible, and that could be a central principle in designing future mental health services. Next, we have the idea of so continuing on with this idea of social bonds and connectivity, practical measures to reduce loneliness and enhance social connectedness need to be looked into more, especially for older adults. And this can be through befriending programs, daycare facilities, and um, similar interventions. And I've just put a picture here of the Zimbabwe Friendship Bench. I'm not sure if anyone's heard of this, but I first heard about this when I was doing anthropology, and it was a community-based psychological intervention in Zimbabwe, and trained community healthcare workers who are often known as grandmothers sit on the bench, and they basically just provide a safe space for people who are seeking mental health support. And I think this again just highlights the commonality of mental suffering, but how social bonds are powerful tools to alleviate suffering and also to reduce stigma. Um, and this is talking about optimizing environments. So if we optimize schools and other educational environments, we can hopefully move away from the inappropriate medicalization of certain behaviors. So just thinking about ADHD as an example, most diagnoses to date have been made in the context of highly structured schooling environments. I know there has been a recent shift in the last few years where more adults are being diagnosed, but prior to that, predominantly people were being diagnosed in school. And schools, I mean, many schools are environments where traits like exploration, novelty seeking, and challenging norms, which might have been advantageous in our evolutionary past, are now reprimanded or pathologized. And even if we think about adults who are being diagnosed with ADHD, this mismatch theory is still relevant because if we think about modern schools and desk-based work environments where people are often sitting down at chairs for 10 hours or more at a time, that's significantly different to the conditions in which our traits evolved. And from this perspective, questions could also start to arise about the ethics of prescribing stimulant medication, particularly in the context of children. Um, Prescriptions are sometimes aimed more at easing the lives of the parents and teachers than supporting the child. That's been argued by quite a few different academics. And from a more social or holistic way of looking at disability, shouldn't the focus instead be on creating environments where ADHD traits can be strengths? And Annie Swainpool talks a lot about this, and she's a child adolescent psychiatrist. And I think she mentioned that when she sees her patients, she first tries to check whether environmental changes can be made. And that's always sort of her first line before starting to think about medication and so on. Um, which I think is a really interesting way of viewing things. And I think it's also a very helpful way sometimes for the parents, because I remember she was saying that when she spoke to some parents of some kids who got an ADHD diagnosis, they were just so worried about their children. But she was able to reassure them that that once they grew up and had more autonomy to choose what they wanted to do, not being stuck in sort of the rigid environment of classes that they didn't like and so on, they would actually maybe go on to thrive if they could find something they really enjoyed and could focus on. Um, and then just very quickly to touch on how we can optimize environments. This picture shows a Montessori environment style, so it's a Montessori style school, and just through a classroom like this, or even increasing the number of outdoor activities, um, that these are ways in which children can then thrive rather than just having their natural tendencies pathologized and being given stimulant medication to try and control that. Um, so then another way to improve this is through social prescribing, and this essentially is a way that whereby patients are linked to non-medical support in their communities. So taking part in things like exercise, volunteering, nature-based programs, arts, dance. But the idea is that by increasing social connectedness, purpose and engagement, even engaging in a new hobby, can really improve mental health and support overall well-being. So then moving on to the second key takeaways and suggestions. So these macro environmental levels are referring to the broader factors that shape mental health. So now moving beyond the individual and so immediate social environments. So at the macro environmental level, the evolutionary perspective helps us to understand responses to large-scale threats like climate change. This is an active threat to current and future generations, disproportionately affecting certain regions and is a growing source of anxiety, especially amongst young people who may feel helpless um, in the face of an uncertain future. And from an evolutionary perspective, this anxiety is not a false alarm, but rather we can think about it as a rational response because as a species, we are hardwired to detect and respond to existential threats. And climate change is something that does represent a real and immediate challenge to our survival. And as this book suggests, there are good reasons for bad feelings by Randolph Nesse. This has been a central premise throughout evolutionary thinking. So the feelings of anxiety or distress in the context of climate change can reflect an adaptive response that has historically helped our species survive threats. And addressing this type of anxiety requires much more than what might be offered at present. So just clear communication about the reality of climate change and the importance of proactive mitigation, the effective policy measures at both national and global levels. And mental health interventions, we believe that they should focus on building resilience, providing emotional support, and also addressing the psychological impact of climate change, while simultaneously advocating for societal actions to reduce its most harmful effects. So, evolutionary perspectives also offer a profoundly destigmatizing narrative, as I have alluded to. They remind us that mental distress is not a sign of weakness or defect, but it's part of our shared humanity, and everyone is susceptible to becoming unwell. Um, so, seeing our emotions and vulnerabilities through this lens hopefully connects us more than it does divide us. And it highlights how the same evolved systems that generate pain and anxiety also underpin our empathy, resilience, and also our capacity for growth. And on this slide, it's just depicting globalization, which has really become another defining reality of our age, where the movement of people across borders for many different reasons, like safety, survival, economics, has intensified greatly. And migration, whether that's been driven by conflict, persecution, famine, climate change, brings both possibilities and pleasures that are unique to modern human societies. But what we're finding more and more is that those who move often find themselves in unfamiliar and often quite hostile environments that profoundly affect their mental health and sense of belonging. And meanwhile, host populations experiencing rapid social change might also perceive existential or cultural threats. Now, from an evolutionary standpoint, these dynamics can be understood, and what we've described this in our paper as deep-rooted tendencies towards in-group, out-group distinction. Um, so mechanisms which once supported group cohesion now manifest as prejudice or discrimination or racism. Um, and we've seen certain groups after migrating, there's increased rates of things like psychosis or paranoia. But adopting an evolutionary perspective doesn't only help explain these patterns at both individual and population levels, but it also encourages a more compassionate and systems level approach. Again, one that recognizes that we're all vulnerable to mental illness, but the human capacity for empathy and adaptation in the face of change is also great. So, just to finish off, essentially, I think what we're seeing right now is that the global burden of mental illness is continuing to rise. And in our increasingly globalized world, an extended evolutionary perspective offers a transformative framework for understanding and addressing mental health challenges. And it's by understanding this misalignment between our evolved psychological mechanisms and contemporary environments that we understand why psychiatric symptoms, which once, in some of their cases, might have been adaptive responses, can now become maladaptive in modern contexts. And evolution is a really powerful way of connecting the biological, psychological, social, and environmental. And I think that it's really important that it needs to be integrated in to medical school education and also in psychiatry training, because it can be a really helpful way to understand patients and also improve outcomes. And just the final takeaway from our paper is that environmental design matters greatly. So the suggestions that we made about urban planning, green spaces, social structures, and climate action, all of these things um, at the macro level and at the micro level. So things like enhancing social connectedness, nature exposure, physical activity, and optimal nutrition that can also complement traditional treatments. Um, and at a population level, these insights can also inform public health initiatives and create environments more conducive to flourishing. And as I've mentioned quite a few times now, evolutionary perspectives offer a destigmatizing narrative with this universality of human suffering and how our shared evolutionary history connects us as a species. Um, as we face global challenges like climate change and migration, understanding these deep evolutionary causes can guide us towards more effective mental health care by addressing both proximate mechanisms but also ultimate causes. And this will hopefully improve the outcomes for individuals and patients, individual patients and also populations alike. So that's it from me. I'm not sure if anyone has any questions, but thank you for
Thank
listening.
you. Thank you, Ria. That was superb. And you've taken us through a really broad overview of principles of evolutionary psychiatry, and then you've brought us on to a new level of discussion on micro and macro environmental perspectives as well, which is really valuable.